and we will do our best to get to those questions and comments throughout the call. Again, we are very pleased to welcome a special guest with us first, Matt Gross, who's with the Department of Health and Human Services, has been working tirelessly along with many others since the onset of this pandemic. And, you know, Matt, we do appreciate the work of DHHS and hope you're doing well on this phase 1 Friday, I'm going to call it. And look forward to hearing the updates you have to share with us. And then we're going to get a pretty extensive legislative update and overview from Ashley Perkinson, NC Child's lobbyist, as well as Whitney Tucker, our acting policy director. And then we want to do a round robin towards the end of the call to just get ideas and updates from others who are joining us today. As always, we'll be recording this in English and Spanish and encourage you all to share this and the resources after the fact. So without any further ado, we have Mr. Matt with us, who is going to talk. And hopefully too, Matt, maybe a positive is I know in your life and many others, we might see some racing entertainment later this month through NASCAR, maybe even a race down in Charlotte. So, you know, anything that's getting us back towards normalcy, I'm all for.
Thanks, Adam. And I feel like since I show up every week now, it's hard to call me a special guest anymore. But happy to be here. I am personally excited that as we enter phase 1, we might get to see a little more entertainment like racing. I've actually spent a fair amount of time this week not only working with Charlotte Motor Speedway, also Hickory Motor Speedway, had a call about Ace Speedway. So it's been a fun time to have my passion and my work cross in a way that they never have before.
Nice.
That being said, I know y'all have some interest in phase 1 and where we are with indicators. So I want to kind of walk through where we are right now. And I'm sure a number of you on the call watch a lot of the briefings that the secretary and the governor do. So some of this might be a repeat for you, but I think it's important information to make sure we're sharing. So, you know, as we enter into phase 1 today, as we laid out a few weeks ago, we're really looking at multiple trends to guide our decision making. And those trends are COVID-like syndromic cases, which is similar to what we do when we do flu surveillance. It's really looking at the numbers of people that are showing up in hospitals that have symptoms that are similar to COVID. So you don't have a laboratory confirmed test per se, but it's a good surveillance tool to get an overall picture of how we think things are trending. Laboratory confirmed cases, which we know has been an important metric. The percentage of positive tests out of the total tests that are being done, and also looking at what our hospitalization number is. So diving into that, starting with the COVID-like trajectory for syndromic cases, the good news is that it's continuing to trend a bit on the downward. We saw a little tiny uptick a few weeks ago, but really, if you look at where we were in the beginning of April to where we are now, with one exception of 1 week, there's been a pretty consistent trend downward. So we think that's certainly a positive trend we like to look at. In terms of new cases, we are still seeing the number of new cases uptick some, but that's laboratory confirmed. You know, one of the things that's important to keep in mind, we developed all of these tools based on available public health data and also White House guidance. You know, and I know we've gotten some folks that have pushed back and said, well, if you test more people, of course you're going to find more laboratory confirmed cases, and that's absolutely correct, which is why that's a trend we're looking at, but it's not the be all end all. It really blends with these other items. I see on the flip side of that, another trend we're looking at is the percentage of tests that are positive. We're continuing to see the percentage of tests that are positive are decreasing, even though our overall number of positives are increasing. Again, when you do more tests, where you find more positives, you might find a higher percentage of negatives. So again, we're not looking at one of these in a vacuum. It's really trying to see how all of these trends are going together. The other trend that we continue to look at is hospitalization. You know, one of the things that we were really focused on when we were trying to bend the curve is, stay ahead of the curve, is to not overload our hospital system. That's the thing that we saw create such an incredibly tragic situation in Italy, created a lot of really challenging pressures in places like New York and Seattle and New Orleans. So what we're seeing is our hospitalization data is generally staying about flat. It's been hovering mostly around 500-ish hospitalizations related to COVID-19 every day for the last week or so. This is a little uptake over last week, which is more in the mid 400s, but still been pretty steady, not a big swing there. So looking at the trends, we like the trajectory we're seeing in the syndromic-like cases. That's in the right direction. We don't love that we're seeing more cases overall, but acknowledge that some of that is likely, it could be due to increased testing. We are happy to see the trajectory of positive tests as a percentage of total tests is trending down. And we're happy to see that hospital trajectory is staying essentially the same. So those are the metrics we're looking at to measure this. And that has led us to enter into phase one. So with phase one, it's a modified stay-at-home order. What we're getting to now is most businesses can now open. There's not a designation of an essential or a non-essential business. Retail businesses, which previously could operate at 20%, can now operate at up to 50% capacity, but need frequent cleaning and social distancing. Parks and trails are now encouraged to reopen. Also, certain businesses such as gyms, personal care services like salons, barbershops, places that do nails and pedicures and manicures, bars, theaters, etc., will remain closed. Restaurants will continue to have takeout and delivery only, and public gatherings are still limited to 10 people, but outdoor gatherings with friends are allowed. So one thing, Adam, you mentioned racetracks on the top end, and that's kind of a fun little one to talk about for me. You know, that's one where, say, like the Coca-Cola 600 scheduled to happen in Charlotte without fans. They're operating as a business that's open, and all that can be there are the employees of the racetrack and the race teams. The public's not allowed. So they're operating under a business at a reduced capacity that can socially distance with frequent cleaning. It's because members of the public aren't allowed to attend the event. That doesn't have it shift into a public entertainment event, which is still not allowed under phase one. Employees are still encouraged to telework whenever possible. Child care centers that follow strict cleaning requirements can open for working parents for those looking to work. So what we are seeing in the child care space is we anticipate hopefully significantly more child care centers will start to reopen in the next week or two. They do have to meet the new cleaning requirements, but that's it. And I will say, I know one question we've gotten is, what about the enhanced funding that's been there for enhanced child care subsidies for children of first responders? That continues to the end of May, but that program will end at the end of May, as will the bonus program, just because there's no funding after the end of May for that to continue. And religious services are allowed to continue. The rule is still no more than 10 people inside, but outside, there's not a cap on the number of people, just so long as folks are socially distanced. Our other big takeaway is the 3 W's, which is wear, wait, and wash. So wear a cloth face covering whenever you possibly can. Wait at least 6 feet apart and avoid close contact, and continue to wash your hands often. Use hand sanitizer. You know, the face covering discussion has been an interesting one to sit in a room full of epidemiologists as they debate it. Because on one hand, there's definitely evidence that shows when you're in areas where you're exposed to lots of people, it's really good to wear a face covering. It can limit spread from the sense of, if you have it and you're asymptomatic and you have it on, let's say you sneeze or you cough, you're much less likely to put the germs out there for folks to get. The flip side is you have to be conscious when you're wearing a face mask. You're often more apt to touch your face, move it. Some people get a false sense of security, like if they're wearing a mask, they don't need to socially distance, or they just don't need to wash their hands as thoroughly. And that's not true. Even with the mask, you should do everything you can to socially distance and stay diligent on the hand washing. Pick your favorite 20-second clip of a song and sing it. So phase one, we're in for for now. In terms of when we'll go to phase two, it's really going to be driven on what the data tells us. The earliest we could be at phase two would be 2 weeks from now. I think we all certainly hope the data trends in the right direction, that we'll be there, but it's a little too early to tell. And then even with that, some of the specific elements around phase two are still being fleshed out and may change based on the data. I think we would want to have the flexibility to get to a place of, if we open up some more public gathering spaces, because the data is generally trending well, but maybe not quite as well as you want, it might change the way that the limits looking at those spaces. So all that guidance is under development. So really focus right now is on stage one. We want to see how we do it. And one of the things with the stages or the phases that we're looking at is, for phase one, we're trying to start to open up more activities that we think are lower risk, settings where it's easier to socially distance, settings where people are less apt to have prolonged exposures, which is why you don't see things like haircutters and gyms opening up in phase 1. Phase 2 will start to open up more of the entities, or lift restrictions on more of the entities that we think are a little bit riskier in terms of transmission, with the hopes that, for one, we've seen how the data is trending from phase 1, and then 2, people are getting used to this new normal. They get more used to wearing a mask in public. I'm sure you all have had similar experiences. A month ago, there's maybe a quarter of the folks at the grocery store were wearing a mask, and now when I go to the grocery store, it's well over 90%. And the ones who don't wear a mask, I think, get some dirty looks from the others. Not that I'm advocating for, certainly not advocating for shaming of people, but I think you're seeing where culturally there's been a shift. And we hope that that shift will continue as people just get more in the habit of wearing masks to other activities that they haven't done previously. So when we continue to open up additional activities, that people are in the habit of wearing masks and still maintaining the habit of social distancing and hand washing, to hopefully continue to limit some of the spread as we go to somewhat activities where there's a little more risk for exposure. So that's really the overview of where we are and where we're trending towards. And with that, I am happy to stop and to answer any questions that y'all have.
Thanks so much, Matt. I know we got a few questions that have popped up in the chat, I think.
Okay.
Yeah, I do see a bunch of questions here. Matt, the first one is from Lamine. It doesn't look like the data really meets the benchmarks exactly. So I'm going to paraphrase. As you tick down that list of 4 indicators, you had sort of 2 positives, 1 not so good, and 1 flat. Were those tweaked to make it to phase 1, or how's that working?
No, so, I think one of the things that's important is we're looking at all 4 together. It's not been a case of all 4 boxes must be going down and then we're there. One of the good but challenging things with North Carolina, we've had some conversations with Dr. Fauci about this. We've been really effective in our social distancing. We have not seen spikes we've seen in a lot of other states. And because of that sort of slow burn scenario that we've created, we're not going to see a significant downward trend because we haven't seen a huge upward trend. So part of what we're looking for in some cases is just being able to kind of hold steady. And really, since the only indicator that's going up at this time is overall lab confirmed positives, which we know is going up over a time where we've also been able to expand testing capacity. And our goal is to get to trying to build up to at least 7,000 a day. And I think we were down around 4,000 to 5,000 pretty regularly. We're pushing over 6,000 now. So it's a number we aren't necessarily as alarmed to see upticking a little bit, particularly because the percentage of positives is continuing to trend down. So it's not necessarily that all 4 have to go down to move to a phase. It's more how are they? I mean, obviously going down is always preferable, but if some remain flat, or again, in the case of the testing one, if there's an uptick in that one, it's a little less alarming given that the surveillance data and the percent positive data is going down and the hospitalizations laying flat. One of the things I personally look at is the hospitalization number as being a really key metric, since we're trying to ensure we don't have a hospital surge issue. So that's really wasn't a tweaking of the metrics. It's just, there's never been a sense that all 4 had to go down to get to a phase. It's really, how do they play off of each other?
Thanks, that's helpful. I'm going to jump around in the questions just to keep us kind of grouped by topics. So a question from Miriam. This is an interesting one. So New York City had to revise their COVID-19 data upwards because they had uninsured people or people for whatever reason not seeking care and passing away at home. Is that something that you all are trying to account for in data or otherwise accommodating in the metrics?
Yeah, that's a great question. So death reporting data in North Carolina is a little tricky. We are one of only 3 states in the country that doesn't have an electronic death reporting system. So what we typically see with our death reporting data is really a lag of 2 to 3 months, because it's a very manually labor-intensive process of getting the death confirmed, getting the death certificate written up at the local source, getting that then transmitted to us, and then manually written into a system. So death reporting is typically a bit slower, and there's a bit of a lag here. So what we're getting with our death reporting are lab confirmed deaths. So you're right, there's going to be a bias towards folks that were able to get some sort of access to medical care because you have to have been identified early on as somebody who has COVID to then be tracked and be counted as a COVID death right now. So it is possible that we could see some of that uptick, although it's also a little unclear scientifically how to determine that somebody who has passed away had COVID, depending on when you found them and what post-mortem testing was able to be done. So there might be a bit of an uptick there, but again, our death data for most data statistics does lag. We've been working really hard to stay as up to date on the COVID death data as possible with the enhanced tracking and tracing that's going on with the local public health department. So that's a great question. One other little quirk that I know there's an article written in Charlotte about this with the CDC and our death data. So CDC has two data sets. I know I'm getting a little weedy here, but one is with the national statistics of, I forget the full name of the group. They report a 0 for our COVID deaths because that group only reports the death certificate data. And because of that lag, they report a 0. However, if you go to the main CDC webpage and look at the state profile, it shows our death reporting database and what we have from the laboratory confirmed deaths, which is what we put on our webpage as well. So that story that was out of Charlotte, I think was a little, at least misleading in the headline. I thought the quotes were accurate that, yeah, we don't have an electronic death reporting system. So for one of the reporting metrics, we can't get there, but for the other method, we absolutely give them our data and they have it factored into their map, which I realize wasn't exactly what you asked, but it's a part of the whole death reporting system. We are hoping to have our electronic death reporting system up and running by the end of the year. We're trying to find additional funds to expedite that. As I think we've seen with, the General Assembly gave a little bit of funding for this throughout the years, but it's never been enough. So we're continuing to try to get that up and running.
Great, thanks. Next question I see is from Greg. Can you clarify the size limit on memorial?
Yeah, hold on. I don't want to get this wrong. Let me pull this up real quickly. I'll tell you what, I want to make sure I double check it with the order and don't get it wrong. So let me follow back up with you and Greg directly after this one.
Sounds great. And then last question from Robin Lane. So, okay, over recent decades, public health funding has been gutted, and she's seeing an erosion with the local board of health in her county in particular. Do you see this happening at the state level, and how is DHHS working with local boards of health separate from the health directors themselves?
It's a great question. I will say we're certainly, I think, have been frustrated and deeply concerned with how much of the revenue that the state has generated through economic growth of the last decade has really just been turned into tax relief and other items rather than maybe a more strategic approach of building back up things like public health infrastructure, early childhood infrastructure, a lot of the issues I know that we all work on collectively. I think that's been a frustration for us over the past decade, and we're seeing some of those challenges bear to light right now. I will say I was pleased that when the General Assembly was in town for the COVID bill work last week, and that they included our ask for $20 million to support public health, in addition to the $25 million for testing. So from an immediate triage standpoint, I feel like the General Assembly is doing a really good job at trying to help give us what we need to address the COVID-19 situation from an acute standpoint. But I think that long-term erosion and how do we get a long-term sustained investment going forward is a really critically important question. In terms of working with the boards of health, it's absolutely part of our outreach. I do think as with any board that you see across the county level, that sometimes the strength of the board is as much about the strength of the leadership on it. Right? I don't know personally the folks on the board in your county. I know we have a lot of great ones that are doing a lot of positive work. So I'd say if there's an issue with a particular board of health that seems like they're struggling or not coming along or needs extra support, I'm happy to talk offline and figure out what we can do to support that board of health to make sure that they're able to assist the community through these challenging times. Because unfortunately, one of the things we keep thinking about is not to be a downer, but we're going to be living with this for a while. I mean, it's really, we're trying to shift to how do we live with COVID-19 as part of our society. Nothing magical is going to happen in the next month or two where we snap our fingers and it disappears. But we also recognize that we can't just be on a complete full lockdown for the foreseeable future. We have to find ways to reintroduce aspects of society, but try to do it in as safe a manner as possible. So this will be an ongoing work. So yeah, if you have a board of health that you feel like needs some additional technical assistance, please let me know. I'm happy to reach out to them or work with them directly.
Great. Thanks so much, Matt. Those are all the questions I see right now. So thanks very much for being with us.
I'll double check that memorial and funeral, or the funeral guidance, and get that out to y'all to get to Greg.
Great.
Yeah, Matt, we really appreciate you, answering the questions and trying to find things out, as you can. We know you're really busy. One other thing I'll just say before you go, I looked at initially looked at results from a group called Parents Together that we work with sometimes. They're a national group. They have a presence in North Carolina. Did an online survey, and about 1,300 people answered that survey. And one of the things that came out of that is that while the vast majority of folks that answered the survey said, yes, I'm feeling economic distress from COVID-19, at the same time, they also said, no, I don't want us to just open the state back up right now, tomorrow, have it be, a free-for-all, because we understand the public health needs and safety of our friends and neighbors. So, and it was an overwhelming percentage of people that answered in that way. So I do think it shows that the vast majority of folks out there are supportive of putting the data and health needs out there, along with looking at the very real economic effects of this.
That's a great point. And I think I've seen other public polling data that I think shows folks have been supportive of the approach. And while I think the concerns of some of the folks in the reopen movement are real concerns, it's how do we get there effectively? Because, we want to make sure that, let's say as we're opening up restaurants, it doesn't do them any good if restaurants start to open up in a way that is unsafe, and then there's a lot of outbreaks, because that's still going to hurt their bottom line, because folks aren't going to want to go there. Same thing with retail establishments. In fact, the Retail Merchants Association has been really proactive and good with working with us on guidance for retail establishments, because they recognize if they start having a lot of outbreaks in their establishments, business is also not going to want to come back. So I think doing this safely in a measured approach really ultimately is going to be the best long-term solution for everybody, even if there's still a little more short-term pain for some entities to get there.
I do see a couple more questions popping up in the meantime. Sorry about that.
I talked too long.
No, I know. There are 3 in one from Miriam. And I think the first one actually is looking at hospitals and healthcare providers and space priorities with COVID versus other illnesses. And I'll say that we're going to dive into those issues more specifically in an upcoming call. So I'll just bookmark that one maybe, unless you want to address that, Matt.
So, so what was the question?
I think the question is sort of, is DHHS looking at this, basically?
Looking at
priorities of COVID taking up hospital beds and not having enough space for other illnesses. And I think maybe the opposite is true in some cases.
Yes, absolutely. That's a high priority. In fact, if you go to our webpage, DHHS, ncdhhs.gov, and go to the COVID page, right there on the top, you see a case count. That's not our daily case count, but underneath there's a ton of data to pour through. In fact, really proud we have one of the most, despite what some of the political rhetoric has been trying to point to this week, have one of the most transparent data dashboards in the country. In fact, we're just featured on a webinar with the Robert Wood Johnson Foundation as a model for other states. On there, you'll see different tabs. There's key metrics, zip code map, county map, data by age, race and ethnicity, gender, cases over time, congregate living, by reporting hospitals, PPE supply, surveillance reporting about the data. So if you click on the by reporting hospitals tab, what you'll see under there is showing total inpatient bed capacity, and then the number of empty beds. Same thing with ICU, total beds, the number of ICU beds that are empty, and then also total ventilator capacity across hospitals. Because yeah, you're absolutely right. If hospitals are completely, it doesn't really matter why a hospital is full. If somebody can't get the medical care they need, it's problematic and can lead to a worse outcome than is necessary. So where we talk about hospitalization from a COVID-19 standpoint, we're monitoring hospitalizations across the board. So yeah, if you want to keep a running tab on that, go to our case count page and go to the by reporting hospitals tab, and you'll see daily updates on how that stands.
Great. Okay. Second part of this 3-part question, immigrant populations who are either uninsured or fearing seeking medical care. How is DHHS addressing that?
Yeah, that's certainly a real and challenging challenge, particularly as right now the main funding mechanisms for the undocumented population is through, or just the immigrant population as a whole, is still through sort of some of the block federal money. And I can completely understand why folks would be nervous about something that's tied to the federal government, given some of their more recent stances on aggressive immigration policies. That being said, federally qualified health centers are open to folks. The free clinics are open. We're trying to get money to them. I know that HRSA is supposed to be starting to reimburse providers directly for COVID-19 treatment and testing, although it's a little unclear what that looks like. We're also getting some more testing centers that are federally funded that are popping up across the state through partnerships with like Walgreens and Walmart and other retail locations. I think we're going to be putting out some more information about that shortly. And those would be certainly at least for people to go in and get tested. And they're just free to kind of show up and get your test and see what the results are. But that's certainly a challenging population to serve. We're also really working on messaging and messengers with not only the immigrant population, but all communities of color, recognizing that there's a lot of inherent bias and racism in the medical delivery system. And it's important for folks to hear from people who look like them and sound like them and are a trusted messenger, because it doesn't matter how much we say it if we're not trusted as the messenger. So we have a whole team that's working on that aspect. And also we have a testing work group that's specifically focusing on how we get more testing for underserved populations. And finally, I'll add one of the things I'm most excited about in the legislation that was passed last week, and we worked really closely, particularly with Democrats in the House and the Senate to get this as part of the final package, is $50 million for underserved populations and for rural and underserved populations. And a big key, that's the underserved part, which will be a lot of communities of color. We know that's a priority group that we need. Those are priority groups we need to focus on to be really strategic about our engagement with.
Great, thank you. And all right, last part of that question is about public universities reopening. And does DHHS have a role in that decision?
So, ultimately, I'd say the good news is we're playing a role in a lot of this and a lot of guidance and technical assistance. I mean, heck, if you would have told me to be on the phone this week with a bunch of local short track operators, giving them guidance on safe ways to reopen their tracks, I wouldn't have expected to be doing that. So we're absolutely working with the university systems. Ultimately, anything that's driven by a closure or opening is either executive order driven or could be driven by the legislature in terms of whether they do or don't open. We play more of the role in guiding folks in that decision making, and then if they're going to open, what are measures they can take to do it in a safe way. I know there's certainly a goal to get students back on campus in the classroom this fall. This fall is also a long ways off. We don't know exactly what, we don't even know yet what June's going to look like. So it's really hard to forecast what August is going to look like. So I think that's a laudable goal, and they should be working towards that and thinking about safety measures in place. And I'm sure I know we have a team that's working with university leaders, but what actually is achievable will really be determined by what we're seeing in terms of spread in the community when August gets here. All right. Well, I've got somebody else who actually needs to come in and use this room for another webinar, so I need to jump off. But if you have any other questions that I missed, please feel free to shoot me an email, and I'll have to answer them. And again, I'll look up Greg's answer and get that to y'all.
Thanks so much, Matt. Once again, we appreciate it.
Thanks.
Yeah. So now we're going to shift gears just a little bit and get an update. I believe we're going to have Ashley up first, if I'm not mistaken. Ashley Perkinson with Perkinson Law Firm and NC Child's lobbyist. And she keeps an eye on all things related to the North Carolina General Assembly. And she's going to talk to us about what happened in the General Assembly last week and maybe even what we can expect a little bit moving forward. Hey, Ashley.
Hi, Adam. Happy Friday, everyone. And thank you again for joining us for this Friday's call. So last Friday when we spoke, the House and the Senate were still ironing out the differences in the COVID-19 policy and funding bills. Senate Bill 704, House Bill 1043. And on Saturday, on May 2nd, they came together and finalized those bills. Those bills passed really overwhelmingly. I think it was unanimous in the Senate. There was only one vote against the bills in the House. So a very overwhelming support from the bills. Again, on the Senate side, there were actually 45 Senate sponsors, which is a really strong bipartisan support when you have 50 state senators, so 45 out of 50. So the individual provisions, Whitney will be going over here in just a few minutes. The total amount for the funding bill was just under $1.6 billion. So it was a significant funding bill. And then on May 2nd, when they met, Speaker Moore did mention that the House will come back to meet the week of May 18th. And actually, he said that he is hoping for and anticipating a somewhat normal session when they come back. We don't know at this point what that means, whether lobbyists will be able to be in the building and the public will be able to be in the building, or whether they will continue to have practices in place for social distancing and just have those legislators there in the building, and certain press as well, as they did when they came in at the beginning of session the week of April 28th. So we do know that once they come back, one of the first items on the agenda is to look at allocating the remaining federal dollars. So you're looking at probably an additional around 1.8 billion that will be available to allocate. And so both the House and the Senate will be looking at doing that. We do anticipate as well that the Senate will come back that week of May 18th to focus on this second round of COVID-19 funding and policy changes. During the committee meetings, when they met to discuss Senate Bill 704 and House Bill 1043, Senate leadership did say that they would be back in 2 to 3 weeks. So we anticipate that they will be back when the House comes back. So what that does leave as well is, of course, the development of the state budget that will focus on appropriations of state dollars. I was actually talking with a legislator earlier today, and the budget projections at this point continue to look really dire, and potentially a $4 billion shortfall for state revenues. And so we still don't know at this point what that final number will be, but obviously a significant hit to state revenue, but still the interest on both the House and Senate side to develop a budget for the short session. And that leaves substantive bills. We did see a number of bills that have been filed since the beginning of the short session, which technically began on April 28th. And one item I do want to mention in regard to substantive bills that will be introduced this session, we do have the new bill filing deadlines, and it is a pretty ambitious turnaround for bills to be introduced this session. So actually, just in looking at the deadlines on the House side, bills that impact the budget must be to bill drafting by Friday, May 1st. So we're beyond that deadline, and filed by May 14th. Bills recommended by study commissions have to be a bill drafting by Thursday, April 30th. We're past that, and filed by May 13th. Local bills to bill drafting by May 5th and filed by May 19th. Senate calendar looks pretty similar. Bills affecting the 2021 budget must be to bill drafting by May 1st and filed by May 14th. And local bills to bill drafting May 5th and filed by May 19th. So they're really looking at getting down to business pretty quickly this session. And as I mentioned, they will come back likely the week of May 18th. So what will happen next week? We are starting to see, really as of yesterday, notices coming in for meetings of the working groups. I know the education working group has scheduled a meeting for next week, and also the economic support working group will be meeting next week. Also, program evaluation, that oversight committee will be meeting on Monday, this coming Monday, and they'll be looking at some of their recommended bills for this coming short session. So I think once the week of May 18th gets here, they will be diving in. And with that, I will turn it over to Whitney to go over some of the aspects of both of the policy and the funding bills that we were really advocating for, and also what we will be looking at for this next round of COVID-19 relief bills.
Thanks, Ashley.
Thanks.
Hey, Whitney Tucker, Acting Policy Director, NC Child. Happy Friday, Whitney.
Happy Friday. Hey, everybody. So I think we're ready for me to just jump right in. I am happy to report that many of the asks from our legislative letter, which so many of you signed on to, were incorporated into the final bill that was signed into law on Monday. This is the state's first take, as Ashley was saying, at coronavirus relief efforts. And again, it includes both policy and funding changes and appropriates a $1.6 billion chunk almost of North Carolina's federal allocation through the CARES Act. That means that there is still that 1.8 billion out there. So nearly $2 billion left for allocating to other priorities. Though, as we talked about last week, the Senate will likely want to hold on to some of that money in reserve because of that budget shortfall that Ashley was just talking about. And we're expecting an uphill battle to make them change their minds. So what did we get? I'm actually going to start with the things that we asked for and did not receive, just so that we move from bad news to good news, because I really like to stay on the bright side. So first up, Medicaid expansion. We, along with many of you, were unable to convince lawmakers to go ahead and expand Medicaid access to all North Carolinians in the coverage gap, even during a global pandemic. I am disappointed, but not truly surprised. The House had proposed in their bill, H1043, that the state provide temporary Medicaid coverage for COVID testing and treatment to individuals with incomes up to 200% of the federal poverty line, and only holding that through the public health emergency, so still temporary. But the Senate disagreed, and the measure just didn't make it into the final compromise bill. The bill does authorize Medicaid coverage for the uninsured for COVID testing during the federal emergency period, but that was already made allowable through the Federal Families First Act. So this just authorizes something they could already do. The bill also includes a temporary 5% increase in fee-for-service Medicaid rates. And this applies to providers who did not receive a 5% rate increase through the state's 1135 Medicaid Disaster Relief State Plan Amendment, which DHHS had previously sent to the Center for Medicare and Medicaid Services. There's also $50 million in there to rural and underserved communities, which I threw in under this bullet because it does include some targeted Medicaid assistance. So we also asked the General Assembly to direct DHHS to pursue a waiver from CMS to ensure uninterrupted coverage for NC Health Choice, which is our state's children's health insurance program, and then to also merge that program with Medicaid. DHHS did pursue the first waiver on their own, so that's great, it did happen, but the merger of those two programs is still on the table and wasn't included. Moving on, get a slide change. Moving on to childcare, this is a big priority that was significantly underfunded this time around and is going to be a big push for us moving forward. We asked for $125 million to a childcare emergency economic support package in our original letter. Since then, we've been speaking to partners and to lawmakers about the fact that that fund actually needs to look more like $180 million. But either way, funding for child care response was only included in this bill, along with several other response areas in a $19 million allocation to DHHS. There are no details that are included in the final bill about how much of this funding will be used for child care response specifically. And that is disappointing. And so it's going to be a major focus of our next set of asks. That said, there are some other bright spots that showed that our shared advocacy really did do a lot to help highlight childcare workers as frontline workers. One provision explicitly includes childcare providers as a priority group for access to antibody testing when that becomes available. And another lifts them up as a group in need of access when a personal protective equipment, so PPE, state stockpile plan is established, and the establishment of that plan is mandated in the bill. There's also a temporary waiver of the 3-year fingerprinting requirement for childcare providers, which should really help from an administrative burden side. So moving on to tech infrastructure, we asked for additional funding for NC Fast and NC Care 360 to make the technological advancements that they needed to support increased online applications, referrals, and reporting for public benefits. NC Care 360 was specifically included in that same $19 million pot that included childcare. And there was also a line for technology modifications to support emergency relief beneficiaries, which could include NC Fast, but didn't specifically. We additionally asked for passage of the Fiber Act to expand broadband options in rural areas, and that wasn't included, but lawmakers did agree on $12 million in funding to the Department of Public Instruction to help students with internet access, including installation of extended reach mobile routers in school buses and the provision of some mobile internet access points in rural areas. Now moving into the most positive news. We asked for $6 million to Feeding Carolinas to assist state food banks, and that $6 million was allocated to DHHS specifically for the food banks, with a note that the funding be split equally among them. In foster care, we requested that the General Assembly direct the Department of Social Services to pursue all available federal waivers, including but not limited to virtual child welfare visitation, temporary suspension of relicensing requirements for foster parents, and then also continuation of board payments for foster youth ages 18 to 21. They included all of that with language that really closely mirrors our letter. We also asked for funding to support virtual visitation and court hearings, and that wasn't included, but alas. Finally, we requested cash assistance to support foster families because many weren't eligible for federal stimulus checks because those checks were based on 2019 tax filings. And the General Assembly acknowledged this, and they allocated $2.25 million to DHHS to provide some supplemental foster care assistance payments to families. Those payments are going to be $100 per foster child for April through June 2020. So, obviously there's more that could be done, but it's a good start. There were also more foster care supports that weren't in our letter, but we do love to see, including a temporary waiver of fingerprinting requirements for adoptions, foster care, and child care institutions, and an additional $290,000 to the LINKS program. That program supports 13 to 21-year-old foster youth, and the funds are directed in the bill for housing and transitional living support for them. So yay. And I know that was a lot. That was a lot of things, but as many of you who provide direct services know, that is unfortunately not enough. There's still, like I said, about $2 billion that lawmakers can use to support children and families through this pandemic and get us set up for recovery. And so our next step is to get them to do that and then to do it well. Can I get the next slide? So NC Child will be submitting a letter to both House and Senate leadership, asking them to not only expend all of the federal funding allocated for them to spend, but also to direct funding to priority areas that weren't covered well in this first bill, like childcare, for example. We're asking that you guys send in input through the chat box or via email about things you'd like to see in our letter, and also write a letter of your own. We know that collective voice does get heard, and you can see that in how many of the things from our sign-on letter did show up in some form in this recently passed bill. So let's do it again. Remember that the primary message is on screen here. North Carolina's families are suffering right now, so relief funds should be spent now. And let us know if there are major messages that you guys are considering at your orgs that you would like us to consider lifting up as well. So Adam, I will turn it back over to you.
Thanks so much, Whitney. Appreciate that update and getting some good news in there. We got to focus on the positive. I agree with you. So let's see, Fawn, I believe there's some questions that had popped up in the chat.
Yep, I do see some questions in the chat. One thing I'll just clarify quickly, I see a question about the rainy day fund, and I want to make sure people understand that the funding that the legislature just allocated that we were talking about is not coming from the rainy day fund. That's coming from the Federal CARES Act. So there is a total of about $3 billion of federal dollars that were sent to North Carolina. 1.6 was allocated, and then there's still a remainder that they're considering. So I think that's an important thing to lift up. That said, I think there's a question for Ashley and or Whitney around the rainy day fund. There's about $4 billion in that fund. Is there any likelihood of the state looking at that?
Sure, I'm happy to take that. So as I mentioned, with the revenue shortfall that we will see going into the discussions as both the House and Senate look at developing the state budget, that's where the rainy day fund funding could come in to help plug in some of those holes. And of course, if there's ever been a rainy day, it's pouring. We've got a very heavy rain right now. And so those state dollars, the money in that rainy day fund can help with the state budget. But as Fawn pointed out, what they're looking at in this phase 2 of COVID relief funding, that will be from the federal dollars, that remaining amount of around $1.8 billion.
Great. And a question from Greg. Since the legislature did not approve a state budget last year, do we think that there will be a real state budget bill this year, or would it be a continuation or something like that mini budget approach that we saw at the end of last year?
Right. I think the budget that the legislature adopted last year, and then the governor vetoed, and the House did the budget override, the Senate never did the override. I think that budget is gone. I don't anticipate that they would try to do another override vote. So I think they will be looking at either developing a new 2020 budget, or potentially, if they're not able to come together with the legislature and the governor, maybe looking at those smaller mini budget bills. But at this point, the goal from the legislators that I've spoken with is to develop a new state budget.
Right. And I think this is some feedback for our ongoing advocacy, full stipend for kinship families to protect intact families and limit child disruptions and trauma in foster care. So licensed foster care providers did receive that extra stipend, but for kinship families, sorry, you can probably hear my kids in the background, did not receive that stipend. Thanks for that.
I think that's a really good point. And any data that someone can send me that we have as far as how many children are living in kinship families that aren't licensed foster care providers would be really helpful. What we really want to be able to share with legislators is an estimate, of how many kids we're talking about here. And hopefully we can move forward with that suggestion with that.
And I think besides numbers, also stories can also have a lot of impact. So if we have families who are willing to share their stories, I think that could have a lot of impact too.
Mm-hmm.
Very important.
Yep. Well, if there's no other questions in the chat, we can move on to a quick round of other updates potentially, although I see a couple of questions coming in, I believe.
Yes, one from Greg. Are we hearing anything about courts hearing evictions again?
Have not heard anything, but if you guys think that it's an important priority, then it might be something that we should consider in our letter, extending for families.
And just a comment about allocation of rainy day funds from Miriam. There's just going to be dire need, rising unemployment and inadequate insurance, and we're absolutely paying attention to those trends and advocating around those things. Question, kin provider stipend. This is also the area that DSS is thinking that TANF may be able to help fund. So never mind. Am I supposed? I can't tell if that's a question or a comment. Anyway, sorry. Moving on. Last question. Could Medicaid expansion advocates move on because no chance this time around? That's a really sad comment / question.
Never. No, but I think that it's a reasonable question to ask. I think that what we're thinking with Medicaid expansion is that if this does not seem like an emergency time to expand Medicaid, then there is never going to be a more emergent time, right? So that we can't really let up on this and just call that, enough. because we know that families need it now more than ever. And that when we keep pushing, smaller populations of people do get considered for, even temporary coverage through Medicaid. And once you're able to get people those benefits, it's really difficult to take that away. And it also gives us more evidence of how much good it does for people's health and also for the economy. And so I think that continuing to push is still a priority for us.
Yeah, I think I agree. I mean, I think in ways that make sense, we continue to advocate, bring light, bring attention to that issue. Another thing that I'll be real interested in seeing data on as we move forward, when or if, I'm sure we can probably get that data, is the number of parents who now become Medicaid eligible and start receiving Medicaid because unfortunately they've lost their income and they've dropped down under that 44% federal poverty level. So that'll just be something for us to keep an eye on too from the parental standpoint.
I just want to point out in the chat, Jamaica is sharing the data around the number of youth in kinship care. About 2295 is the number of youth in kinship care, only about 125 in licensed kinship homes. So I think that really speaks to the size of the issue. And yeah, thanks for that information, Jamaica. Another question, a federal sign-on letter. Oh, this is important, about expanding ACA enrollment periods. So letting folks sign on to those ACA plans. Is this something that we're tracking and advocating for?
So as of right now, tracking, but haven't actively advocated for the expansion of enrollment periods. But that is something that we can look into and maybe move forward. I'm not sure if it's more useful to talk about a longer enrollment period, or if it's more useful to talk about casting a wider net in terms of who should be eligible. But I think that, they're not mutually exclusive. So I think that's a great idea.
And I do know that a couple, the Justice Center may be doing some work around this, and the Care for Carolina Coalition sent a letter up to our federal congressional folks asking for a variety of things around healthcare needs, and one was a special enrollment period for the ACA. But from what I understand federally, that's very contentious, and advocates aren't super hopeful that it'll be included in the next stimulus, but we'll see.
But it can't hurt to have an additional voice, right? And we do federal advocacy as well. So, we're happy to lend our voice to that cause.
I don't see any more questions popping up in the chat, but just want to remind people that after this call, we'll send out the video recording in English. We'll send out a Spanish version by the end of the day today. Our legislative update email is also going to include a summary of all the bills that have been filed since the session started. So watch for that in your inbox. And if you have other ideas that you want to share with us for our advocacy going forward in the state legislature, you can just respond to the emails we send you with those suggestions, or reach out to any of us directly. And I don't see anything else coming into the chat, Adam.
All right. Okay. Well, thanks so much, Fawn, and thanks everyone for joining us again this week. We really appreciate it. We also encourage you, like Fawn said, to send us ideas, tips, etc. in between these calls. And next week, we'll be back with another call next Friday. The Friday after that, the 22nd, which is the beginning of that Memorial Day weekend, I think NC Child is going to be taking a day off that day. So we will not be doing that Friday call on the 22nd. But besides that, we're going to continue these calls. And of course, with the legislature coming back into session and doing more work, there'll be things to talk about on that front. And also, we're going to continue to feature important topics on these weekly calls that we know are relevant. For example, leading into June, we're going to be talking about the issue of mental health, the increasing needs there for children and families, and doing other hot topics as well. So thank you, everyone. Please share this with others. And thanks so much, and have a wonderful weekend.